Okay, so I will call the meeting of the Finance and Planning Committee for the Health Commission today, August 2nd, to order.
Thank you. I will do roll call. Commissioner Guillermo,
Present.
Commissioner Chow.
Present.
I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. Commissioner Guillermo, would you like me to call the items or would you like to call them?
No, please go ahead, Mark.
Okay, great. Item 2 is the approval of the July 5th, 2022 Finance and Planning Committee minutes.
Thank
I
you.
would move approval.
Okay, and I will second.
There's no one on the public comment line, so that can be the action. And we can move forward with item 3, the monthly contracts report.
Just a comment on the minutes. They were quite well done, so I just wanted to mention that.
Thank you.
It reminded me that we do engage quite well.
Yeah, it was. There were several robust discussions, so thank you, though. I appreciate that. All right, Mr. Goodwin.
Good afternoon, commissioners. It's nice to see you all. I'll be filling in for Michelle Ruggles, as Mark said he was on vacation this week. I'll start with the monthly contracts report, which have 3 items. The first is an amendment to the COVID task force contract with PHFE, doing business as Haluna Health, for a total contract amount with contingency of $6,024,377, with contract term remaining the same for the 16-month term of March 1st, 2022 through June 30th, 2023. This contract is to continue the support of the COVID Command Center Emergency Response Services with additional COVID funding in the amount of $1,703,371 to further augment testing, data intelligence, and support at various facilities. PHFE, doing business as Haluna Health, will continue to provide program administration to support DPH programs and activities, which include all emergency response staff recruitment and facilitation, clinical support staff, subcontractors, and consultants, and other as-needed specialists who participate through this contract. The proposed amendment agreement is authorized under RFQ 3-2020. The department is requesting approval of a total contract amount of $6,024,377 due to the following: $1,320,684 of general fund for fiscal year 21-22 for the term of March 1st, 2022 through June 30th, 2022. Second, $4,199,726 of general funds for fiscal year 22-23 for the term of July 1, 2022. It's a tongue twister, through June 30th, 2023. This includes a 12% contingency in the amount of $503,967 on the fiscal year 2023 funding total. Proposed amendment agreement is authorized under RFQ 3-2020, as I said, and additional funding will continue to support COVID-19 modality services. If you have any questions, Alice Kerniati, manager of the DPH Office of Managed Care, is here to respond.
Thank you, Mr. Goodwin. Are there any comments or questions from Commissioner Chow?
Yes, I had a question. What were we going to be augmenting when we made the original proposal? So what are, if any, new, are there new programs, or is it that the proposal anticipated less personnel, but with the continued COVID activities, then we needed to fund it? Just trying to understand what the extra amount of money is going to be for.
Good afternoon, Commissioners. This is Alice. So this In the prior fiscal year, in fiscal year 21-22, there were multiple COVID-related contracts for Haluna, but they had different ending dates. So we had one that was a general COVID kind of task force contract, and then we had two contracts that were set up earlier during the response, one for contact investigation and contact tracing, one for EPI and lab services. Having multiple contracts just made it harder to administer and from a programmatic perspective. So what this contract amendment is really doing is consolidating the positions that were continuing on from those other contracts that ended on June 30th of 2022. And we're basically just consolidating from multiple contracts into one contract. So overall, the result is this contract is augmenting in the scope in that we're adding additional EPI resources, additional contact tracing services, but as a whole, it falls in line with the overall plan that we have, and it as a total of from 21-22, it represents a reduction. So that's what this the services that are augmenting it is.
Very good. That's I think, very helpful explanation that which I think will help us understand that we're not adding services but actually combining different contracts essentially under this. Is that right?
Yes, and so it would just make us easier to administer and manage the program.
Okay, I appreciate that. I don't have any other questions.
Okay, thank you. Continue.
Okay. Next, we have a new agreement for existing services with the County of Santa Cruz. The County of Santa Cruz is the designated host county chosen by the local government agency, the LGA Consortium, to maintain the CMAA TCM trust funds, which are county-based Medi-Cal administrative activities and targeted case management, and also to coordinate administration of the participation fees for all counties in the state. The total contract amount with contingency requested is $1,489,500 with a term from July 1, 2022 through June 30th, 2025 for a total of 3 years. The proposed new agreement is authorized under Section 21.5 of the Administrative Code. The County of Santa Cruz is the only agency that can provide the services due to a contractual agreement at the state level with the Department of Healthcare Services. The department is requesting the approval of a total contract of $1,489,500. While this is a new contract for comparison purposes, the proposed change in the total contract amount of $937,563 between the two contracts is due to three things. One, prior contract was under budgeted. Two, revenue percentage increased from 8.9 to 11%, resulting in an increase in participation fees. And three, the consortium budget fee has increased from previous years. The proposed total contract amount of $1,489,500 includes an annual amount of $375,000 for fiscal year 22-23, $402,500 for fiscal year 23-24, and $453,750 for fiscal year 24-25, and an overage fee amount of $248,250, which is the 20% contingency value amount applied for fiscal years 22-23 through 24-25. If you have any questions, Rowena Marania, the Medi-Cal Administrative Activities Coordinator, is here and available to respond.
Okay, thank you, Mr. Goodwin. Again, any questions from Commissioner Chow?
I just thought of one now. These are the administrative fees for us to draw down revenues by way of Santa Cruz. And I'm amazed it's been a year since we saw this contract before. But is there any idea how much money we do draw down with this? Um, these are the administrative costs, so we have to put them out. But is there an idea of how much in funding from the state that we're talking about?
Yes, hi, Commissioner Chow, and the Health Commission. This is Rowena Maranya. Yes, we generate about a little over 14 million a year in revenue. And where our mod time is reimbursed at 50 to 75% FFP, depending on the type of work.
No, that's fine. Thank you. I'm just trying to understand the scope of what we are actually trying to draw down. So I don't have any other questions, and um, this I know is something Santa Cruz is doing for us. So
Yeah.
Mhm.
And I did have a general question about this. Does the Department of Health Services, do they is there a competitive process for counties to be the administrator, or has it always been Santa Cruz? I just don't know the history.
It's not it's not always a competitive process. There are certain years where counties volunteer,
Mm.
and then there's a vote. But in most recent years, it's usually only been like one county that steps forward to to um to be the host county. Previous to Santa Cruz, it was Plumas. And then the year before that, or the time before that, it was San Mateo.
Okay.
So it's a
Okay,
tough,
yeah.
it's a tough job. They don't always have. There's not a lot of counties that are vying to be in this role.
That's what I thought. That's why I thought, Santa Cruz would be, even if it was competitive, there probably wasn't there weren't that many counties that really wanted to
No,
take this on.
but
So
we're very grateful for the counties that step forward.
yeah. Okay. Thanks for that background.
You're
Okay,
welcome.
Mr. Goodman, we can continue on.
Great. Number three is the approval of a contract amendment to add additional specialized resources to assist in the Laguna Honda recertification project and to add additional hours to already existing contract resources. Specifically, new resources may include nursing home administrators and assistant administrators, infection control specialists, and discharge transfer coaches. The department is requesting the approval of a total contract amount of $6,989,564. The requested actual increase in funding of $5,211,317 is the result of the inclusion of new as needed specialists and additional hours for existing specialists. Wanted to point out this is less than a 12-month contract, and annual amounts listed in the table that you received are for illustrative purposes only. If you have any questions, Commissioners Baljeet Sangha, Chief Operating Officer and Deputy Director of the San Francisco Health Network, is available.
And Commissioner, I apologize to interrupt Commissioner Guillermo, but I did email you some preemptive responses to issues around some of the factors in this contract.
Right. Okay. Thank you. So again, any comments or questions from Commissioner Chow?
I think my question is, I mean, this is an important contract. It helps in, which I think we should point out because it is the implementation of the pilot program for Laguna, which is really wonderful that we're fast tracking it and putting it together. So I'm somewhat concerned that the contract term is only to December of 2022, which is just 4 short months from now, and therefore it ends up in the middle of our fiscal year. So it isn't that we can then put that into next year's budget if this pilot does all that it's supposed to be doing. So what is our plan after 2022? What do we do January 1st? We have these nurse administrators and this structure. So just trying to understand how we continue to move forward on the blueprint, even after recertification. If this is the right path, then what is our game plan here?
Great question, Commissioner Chow. I think one of the two components. One is in terms of answering the question of why is it till the end of December? And, you know, our original timeline and original runway for recertification was certainly within this calendar year of 2022. And at this point, the focus of the organization, of the Department of Public Health, everyone within Laguna Honda is to stay remaining on that path. And so HSAG is the group that has been brought in along with HMA, but here we're talking about HSAG specifically, to really help us shepherd us on that path, right? They are the expert consultants, the experts that know the rules and regulations of skilled nursing facilities to get us there. So that's the reason why we haven't projected beyond 2022, because our goal and the need and the utilization of these resources are congruent with the pathway to achieve recertification. So that's that part of it. The other component, though, that you ask is, you know, what are we going to do after this, after they leave? We have, as you can, you know, from the summary that was provided, it certainly includes the nursing home administrator and assistant nursing home administrator component of it. And so right now we are, you know, just to quickly repeat some items from previous sessions we've talked about, the NHA and the ANHA, so nursing home administrator and assistant nursing home administrators, this is part of our pilot reorganization. So these two components are certainly net new individuals that are consulting and providing expertise, partnering with our interim CEO, or AKA our San Francisco Health Network CEO, Roland Pickens, and other leaders to provide coaching, counseling, and how to really think and approach it as an NHA. The goal for the long-term sustainable piece, though, is to make sure that we have those positions as city and county classifications. And so those would not, you know, these would be positions that we want to eventually bring on board as CCSF classifications, aligned with all of the appropriate civil service rules and any kind of applicable MOUs. And so between now and the end of this year, the goal is to then, it being a pilot, one, we need to make sure we can assess the outcomes of the pilot. How's the data? How's it looking? Is it working the way we're actually hoping to have it work? And does it truly affirm the need that it is these types of roles that are critical for us? We believe at this point it has, but we do want to have that data for it. Once we have that data, that will be then the partnership with our human resources colleagues around the appropriate classification, the levels, the appropriate type of role that needs to be then eventually in our timeline here in the next several months be posted, so we can recruit talented individuals to then fill the need that has been affirmed by the pilot results. So that's really kind of the component. I think you make a great point around then what's next after the entity leaves, and that's really the plan for how we want to make sure we can ride this wave into a sustainable structure.
Thank you, Mr. Sung. Ed, do you have a follow-up?
Yes, please do.
Oh, no, I meant, do you have a follow-up question?
No, it would be in relationship to the memo that we got. I was a little confused about the travel rates. We are or not going to pay the CONUS rates. I understand why we should be paying a premium to it, but the way that the memo ended up that we got, it wasn't clear, because you then cited CONUS and said we'd be paying CONUS rates.
Yeah, absolutely. Thanks again for the question, Commissioner Chow. So we are following the federal GSA CONUS rates, but the one thing in the questions I believe that were shared with you, or the answers, was that as the program administrators, we certainly can pay above the CONUS rates. The CONUS rates doesn't mean that this is it and that's be all end all. We certainly have the ability to pay above that rate, but when we apply our San Francisco lens, both of hotel stays and other things, that there oftentimes is a dissonance around what the CONUS rate calls for versus what is a competitive rate within the city or something that's adjacent to a hotel. So with our accounts payables colleagues, we are keeping a fine lens and a fine focus on making sure we are paying these rates. But if they do go up, we do ask those pertinent questions around why, what's going on. Can you share us a sampling of other rates of similar hotels in the region, just to make sure we are at the right benchmark? And at that point, we can move forward. So that's probably why it was confusing, that yes, we do follow federal CONUS rates, but also we can pay above that, but it's really paying above that within the context of some critical thinking and approach to it. We don't want to just certainly don't want to just say, yeah, that's great, this price sounds good, without the actual research to follow up, say, in front of our governing body. If the questions were come up, we want to make sure that we're very clear on being able to document that.
Yeah, well, there's no question. I think we have to pay above the government rate in order to be sustainable in San Francisco. So I was hoping that that was the answer, and that it wasn't that. But by the time it ended, it sounded like with your a snippet of the specific clause, we were back to the Conus rate, which I don't think is sustainable. I'm in full agreement
I
with
would
the
agree.
flexibility.
Yeah, absolutely. Yeah, I apologize that that was confusing. The intention was just to make sure that we, you know, we're drawing back the statements back to this kind of focused documentation writing, but I can certainly see how that would have been ambiguous. Thanks for the opportunity to clarify.
Thank you. I had a question that you might not be able to answer right now, but assuming that the pilot program warrants a continuation, what might be the gap between gathering the data to bring to HR with regard to the classification of the positions and the actual recruitment of that? I'm just sort of wondering where there might be, just some discontinuity between having contracted with those positions and then being able to hire them on as regular CCSF sort of classified positions, and then doing the recruiting, because that always takes such a long time.
Yeah, you know, that's actually a great question. It's also something that's been very concerning for us, because it's I think the administrative side of things, identifying the appropriate classification, and then that classification being in the budget to then hire for, I think that is one thing. And I do believe that with the partnership we've seen from our human resources team and also with DHR, that we would be able to hit the timeline of having that position ready and available to be filled and posted before the end of the year. The challenge, though, is that that's very different from having a talented individual that meets all the skill sets. And I mean, as our governing body here knows, that we are wanting to make sure we can establish leadership and a culture moving forward with the appropriate leadership and skill set and expertise in a skilled nursing facility, that we're going to probably have to do a nationwide search. We're going to have to engage in kind of a lengthy process that is, that demonstrates a due diligence. So you're absolutely right, Commissioner Guillermo. I don't know if, I don't know how long of a gap that will be, but that's something that we're starting to look at now because if there's a commensurate need to partner with an agency to help us with that level of focused niche recruitment, we also want to make sure we can do that sooner than later. And potentially that might be something that comes back before this group for sharing.
Yeah, that's what I was thinking, that again, given that it's such a short-term contract, and that gap might potentially be something that can't be managed, under our control, that there may be an extension that might be required, or something else to sort of make sure that there is continuity in assuming a successful pilot. And
I will take that back as a focused follow-up. I mean, you highlight and it once more to bring to the front burner, just because we also don't want to have the revolving door of the same contracts every month or every other month, but kind of having a focused plan. So certainly we'll take that back. Thank you for thank you for pointing that out.
And just a note to Mark, we might want to make sure that this is also followed up with on the JCC. Somehow, making sure that it comes up and it's part of our meetings.
Yes, I'm making note of that, especially for the months ahead in the fall.
Yeah. Okay, thanks. Okay, Dean, we can go ahead, I guess, to the new contracts, or should we, do we need to vote on these first?
Yes, please, motion, and just vote on the whole thing together as one vote.
Okay, do I have a motion?
Yes, and I would like to add to the motion a little commentary regarding this particular contract that would be helpful to the remainder of the commission to realize that this is a implementation of our program that we received at our last meeting, so that public will understand that we're moving quite quickly, and the department is doing this in earnest, because I think this would be a good opportunity to say, we're putting our resources where our mouth is. So So I just asked that we do that, and I could add to it too, because I have understood that some of the public wasn't, of course, they weren't part of our closed session, but they didn't quite understand whether we did or didn't agree to the presentation. So I think we could use this to show that obviously we are in agreement and we're funding it.
Okay, so we'll put that in the notes when we report out this afternoon.
And then Commissioner, can we hear a second on his motion? That was a long motion, but that was a motion.
Yeah, second.
Yes, that was a motion.
Just so I do my due diligence and have it on the record. Great. Thank you very much. And thank you for all the folks who helped clarify the commissioner's questions. Let's move on to item 4, a request for approval of a new contract with Trifacta.
Okay, I'll just briefly introduce this. It's a contract approval with Trifacta Inc. To provide as needed staffing for the Laguna Honda recertification process. Total proposed contract amount is $3,500,000, which includes a 12% contingency for the term of June 17th, 2022 through December 31st, 2022 for 7 months. And again, Baljit Sangha, Chief Operating Officer and Deputy Director of SFHN, is here to provide a bit more program detail and answer any questions you may have.
Okay, any questions, Commissioner Chow?
I guess it would be sort of the same question, because this only goes up to 2022. If we actually needed these positions, would we be in the course of actually trying to, because I imagine, well, first of all, are these positions already there and not properly filled? Or are these new positions as part of the reorg plan? And it goes back to the previous question. Then what do we do after December 2022?
Okay, I think did Baljit go?
Oh, nope, sorry, I'm still here. I apologize. Just trying to multitask, unfortunately. I did hear your question, Commissioner Chow. So you're absolutely right. I think there are a couple, again, here, I think there's 2 factors I want to highlight. We do have the ongoing process of filling positions that we are budgeted for, and that is continuing to occur. Our goal is, especially as we partner with our own labor unions who have been phenomenal partners in the process, they're making sure that we can get those positions filled. But at the same time, we also want to make sure we're retaining and maintaining our progress for momentum of getting folks in sooner than later to have a kind of a turnkey workforce. So that's one thing around to answer that question. But the priority certainly is and continues to be ensuring that we fill the positions we have. Secondly, we want to make sure we're part of this process to determine which positions are then are validated to be required as part of a if you call a, lack of a better term, like a structural fix, like something that needs to have moving forward. I know that has a focused connotation within the budgeting world, so I would just offer that I share it as I'm at a loss for words, but really positions that we know that are going to be needed moving on as part of permanent budget ongoing, and that would be something where we partner through the budget process that occurs annually with our CFO and our leadership to make sure we can build that in accordingly. The third, and I lied, I said there were 2. Third one, actually, the last one, is the fact that some of these positions are helping us for really point in time support. As you know, that we have talked about specific projects that need to move forward. One example is the kitchen project, the kitchen floor renovation at Laguna Honda, a significant renovation and repair that needs to occur to ensure that we're positioned well for recertification here later this year. Now, part of that process and that point in time project is that we do need to have support in our dietary and our FNS team to ensure that meals, as we pursue the contingent kind of temporary meal process, it continues to meet the dietary needs of our patients. It continues to meet all the regulatory requirements for meals, both in temperature and quality. And so that requires some additional support, but that's not an ongoing need. That is, once the kitchen is repaired, when it's done, we will revert back to our standard processes, which means those positions will not be required. So that's part of it. So I just want to make sure it's not interpreted as an ongoing continuation kind of throughout the next several months and years.
If I could ask a follow-up then, you've selected this particular company to do this on an emergency basis. What is their track record? Because it looks like they're a single person company. And do we have other references about where they have placed these, these types of services before?
Absolutely. We do have references. I know the team, the clinical team that worked out to make sure that, we actually have skilled individuals. And again, the positions that are in question, dietitians, dietitian technicians, social workers are also licensed positions, licensed disciplines. So I do know that we did pursue a follow-up as part of the reference check of this process. Unfortunately, I do not have that information in front of me in terms of who those references were, but I do know the fact that it has pursued this far, that the reference checks did come back positive. Would not have advanced it this far in front of the commission had it not deemed, had it not come back as glowing recommendations. But I can certainly follow up after this meeting in a more focused way to get that information.
Okay, I think it would be good for our chair to actually understand that before she presents it, so that this sounds like a small firm, and I'm sure you're correct. It seems to say that they have offices all over, but it'd be sort of nice to know that they place services at Santa Clara County and LA or whatever it is.
Yeah, one of the other things just to highlight too is that in addition to the current issue that we're facing with ensuring that Laguna Honda is on the path for recertification, we also, as part of a non-incident time, non-activation, non-pandemic time, one of the focus for the Department of Public Health particularly has also been to ensure that we are providing opportunities to minority, women-owned companies, other things, to ensure that we are, I always like to use the term kind of an anchor institution, right? We are an anchor for the community, not just hiring from the local community, but we're hiring people from that community who then will infuse the outputs of that employment with dollars back into the local community and kind of grow the community. So you're an anchor institution that is growing the community. This company particularly is a minority women-owned company. So part of the if one were to do an internet search and see that they're not really broadly out there like maybe a common huge kind of multi-billion-dollar company, it's certainly because this is an example of another entity that's trying to grow that footprint, and we're trying to make sure we can also do our part of not just meeting an urgent need here with the recertification, but also still not forgetting our overall obligation to what we're trying to do, empower and invest in local minority and women-owned companies. So that's while I still will take this follow-up back, it might not answer the question entirely. It also helps explain a little bit why there may not be a broader footprint that maybe we're accustomed to seeing with maybe large-scale staffing agencies.
Yeah, I don't have any problem with all the good intents, and just wanted to ask from due diligence that, and certainly if they are already with offices in San Francisco, San Jose, and Los Angeles, etc., it sounds beyond perhaps a single person, but the way it was reading, it kind of looks like it's a one person board and one person owner. So that was just my concern, and I think that to me, this would also be another opportunity to show that we're moving quickly on the Laguna recertification.
Right, noted. So we'll share that information again to the full commission in our report this afternoon.
And Commissioner Guillermo, if you don't have questions, would you two please consider a motion and second so that this can be moved formally to the full commission, this contract?
I would move it if Commissioner Guerrero didn't have any other questions.
No other questions, and I will second.
Thank you very much. And thank you, Baljeet, for both those contract reports. Item 4 is a request for approval of a new contract with the Regents of San Francisco, California to recruit, train, and support a cadre. Oh, actually, it's all there. And we've got Emily Raganold. here.
Okay, thank you. Emily, do you want to present this request?
Yes, thank you so much, and hello, commissioners. My name is Emily Ragnold, and I am a health program coordinator with Behavioral Health Services. I am here today to give a brief overview of the requested approval for a new contract with the University of California, San Francisco for the Bridge program. Behavioral Health Services was recently awarded funding through the National Association of City and County Health Officials for the Implementing Overdose Prevention at the Local Level grant. We would like to award UCSF Bridge with $379,866 for their Emergency Department Clinical Champion Program for a 23-month contract from August 1st, 2022 to June 30th, 2024. We are requesting a sole source contract as UCSF Bridge was named in the grant application and is the only vendor poised to provide these services within the timeframe of this grant funding. I'm now going to pass it to Dr. Hannah Snyder, who is the co-principal investigator of California Bridge and assistant professor at UCSF, to give more details on the Bridge program.
Hello, commissioners. I'm Hannah Snyder. I'm faculty at UCSF and work at San Francisco General. So this is a program that's going to provide intensive technical assistance to support 8 emergency departments in San Francisco, specifically around reducing overdose deaths. There'll be multiple arms, including increasing rates of initiation of medications for opioid use disorder in the emergency department, increasing naloxone distribution, and then also increasing linkage and navigation to treatment. We have 8 San Francisco emergency departments that have already been funded to have substance use navigators on site. And I can discuss which ones those are if that's of interest. But these emergency departments don't yet have the support that they need to have clinicians trained to appropriately use medications for opioid use disorder, have a robust naloxone distribution program, or a robust network of linkage for those navigators. And so through this technical assistance program, we're hoping to provide intensive support both for clinicians on the ground at each hospital and for navigators on the ground at each hospital so that they can provide more comprehensive support for people who are at risk for opioid overdose in San Francisco.
Thank you, Dr. Snyder and Ms. Ragnold. Dr. Chow, do you have any questions?
Well, I'm trying to see. I mean, it sounds like a great idea, but how does this actually work? A hospital then funds a position or designates somebody in the
Great question.
room, and then what does do we send a coach in, or I mean, it's an important function and important to get education, so it's quite innovative, I think, rather than just letting each hospital try to make it through the opioid patient. But what actually then do they get, and do they get a protocol that then says also, and here are 7 places to go for an educational thing, or we're going to send you over to PES or what?
So one of my other hats is that I help to run a statewide California Bridge program. So the state of California through DHCS has funded now over 200 hospitals in the state of California to have navigators through time-limited grant funds. So each hospital has now received approximately $120,000 to hire a navigator for at least a 1-year duration. And this has already occurred. So those positions are already funded, and that's a renewal of previous funding. So the navigators are there, although they are working on sustainability plans for that in the long term. What's not really in place is the additional support that those navigators need and the clinicians need to move through this system when most emergency department teams haven't had a lot of experience directly treating people who use drugs for their opioid use disorder. And so what this program will do is myself and a couple of colleagues who work in emergency medicine and in patient navigation are hosting bi-monthly meetings for the clinicians and for the navigators, doing case discussions through what's called an ECHO model. We're doing site visits, including one today actually to St. Mary's Hospital, and have protocols that have been written at the statewide level that will then be adopting also for the San Francisco level. Those give a lot of concrete dosing information about how you start these medications. And then we've developed San Francisco specific guidelines on where are all the places that these folks can go for follow-up what are the insurance barriers and what do navigators need to know to get them where they need to go. Does that answer your question?
Oh, very ambitious and very exciting. Are you also going to be doing at the end of this grant, or maybe along the way, sort of a progress as to how that is coming? Because this is absolutely a very worthy goal.
Yeah, absolutely. So we started out with a baseline assessment of the sites. We've started to engage with them in some mild way already. And so we do have a baseline assessment for each of our sites. Each site that was funded by the state through these Bridge Navigator funds is required to report back monthly metrics. And so we're able to access those and trend how our hospitals are doing over time, which will allow us to in real time see how this is going. And then at the end, we'll have a more comprehensive follow-up assessment at about 12 months after initiation of the program.
And how does this fit in with the city's own programs on opioid care, I guess? Yeah.
I think the majority of patients do end up getting referred to city programs. Well, there's probably some nuance to that, but many of the city programs receive a lot of the folks who are discharged from these hospitals. So I think about the OBIC program, I think about the Ward 93 OTOP program, I think about some programs that we have at San Francisco General as well. Those receive many of these patients. There's also a subset of these folks who might say follow up at a BART program or a Health Rate 360 program. So we'll keep open the options of anywhere that a patient might want to follow up to receive their care. But certainly the city provides a really robust infrastructure of care. And we'll also be working together with the Office of Care Coordinations to make sure that patients are slotting into the appropriate locations.
Yeah, very good. Thank you. I really appreciate the explanation and look forward to its success.
Yeah.
Thank you very much.
I have a couple questions. One, this is a federal grant through NACCHO. Do you know where is the origination of the federal grant? This is with SAMHSA or with another federal?
This is originating with the CDC.
Oh, with the CDC. Okay. Just curious about because the different federal health agencies have different robust ways of funding and following up. So it's just sort of, and then taking demonstrations and then committing to them versus not. The other question I had is, can we follow up? Can you give us a list of the 7 hospitals in San Francisco that are participating, just so that we can get a sense of whether there is undue pressure on anyone, or if this is sort of evenly, because we have a sense of where a lot of these substance abuse patients end up, and so wanted to be assured that there's going to be a good participation across the city and county.
Very excited by our participation across the city and county. Would it be helpful for me to share that list now?
Sure.
So we have a UCSF Parnassus, San Francisco General, Kaiser San Francisco, St. Francis, St. Mary's, and then the 3 CPMC hospitals. So Mission Vernal, Van Ness, and Davies.
Okay, good. So that is sounds like good full participation across the both public and private network of hospitals in the city. Be interesting to see what the data shows in terms of the use of the or I guess the encounters that these hospitals have with these patients and how they. So again, you could see that there's interest on the part of this committee, and it'd be one of those things that I can imagine a number of the commission members or the full commission would also be interested in hearing more about this as the project continues. And so wish you well, on that.
Now, Commissioner Guillermo, if I could follow up on your follow-up about that, I think it's interesting because the other hospitals left out are basically the VA and Chinese, and I'm just wondering, where have we looked to see whether those two have already? It might be that Chinese doesn't really have a large number. Because it is a fairly small emergency service. But VA, I would think, has a number of problems over at the VA. Whether they receive it by way of the emergency room, I don't know. So making sure that there is some equitability of if they, for example, have a large number, whether they should be participating or not. I think that's sort of just in follow-up of this question. Are we covering 80, 90, 95% of those that come to an emergency room?
So Chinese hospital, we went based on hospitals that were already funded to have some navigators, and then also hospitals that had a relatively high prevalence of opioid overdoses. And so that is how we kind of came to that initial list that I provided to you. But I think we're very open to expanding or changing that or having further conversations about any of that, and have reached out to all those hospitals in one way or another to make sure that they feel like they can participate in any way they would like to.
Yeah, I guess it's just mostly a matter of need, and if they don't really have that need or they don't see that much activity, neither of those. I mean, Chinese is small, and from the report that we're going to get shortly, it has been participating. It's helpful, but they just don't, they don't have the same volume. You've got the big volume hospitals. That's great. And again, VA may not have a big active emergency service. I'm sure, do have substance abuse issues that they take care of, but not for perhaps the entrance by way of emergency service. So I'm not saying that they really need to be part of it. I think that we just have to make sure that the people that you have are part of it really have the bulk of the cases, and it sounds like you do. So, thank you.
Okay, great. So should we call for an approval?
Yes, I will. A motion that we recommend to the commission for approval.
Okay, and I will second that.
Great, thank you. Excuse me, we can move on to item 5, emerging issues. Thank you, everyone, for
Thank
presenting.
you all.
Colleen Hong. Emerging issues, any comments, commissioners? Okay.
None for me.
Yeah.
Item 6 is public comment, and there's nobody on the line. And so we are at a consideration for adjournment, item 7.
Oh, and my goodness.
We've been abandoned. They all left.
I will.
They
I'll
just
second
assumed we'd be done.
adjournment. So I move adjournment.
Okay, and I will second that.
All right, thank you both. I'll see you in an hour or so.
Okay, take care.
Thank you.